Well, it's 5:30 a.m. in Vancouver in LA. It's 8:30 a.m. in New York. It's 1:30 p.m. in London, 2:30 p.m. in Brussels. It's 5:30 p.m. in Dubai. It's 7 p.m. in India, 9:30 p.m. in KL and Singapore. And well, it's well past midnight in Sydney. Good morning, good afternoon, good evening to our friends from across the globe. Namaste. I'm Anupam Sibal. I'm the Group Medical Director of Apollo Hospitals and the President of the Global Association of Physicians of Indian Origin. And I'd like to, on behalf of all of us at GAPIO, extend a very warm welcome to Ms. Rebecca Love, Dr. Agnes Taradi, Dr. Nandkumar Jairam, Dr. Arun Gurg, Captain Dr. Usha Banerjee, Professor Rita Lakhani, Major General Elizabeth John, Dr. Manju Palam, Ms. Sridevi Balachandran, Ms. Lalita Iyer Goyal, Dr. Tandon, and the amazing nurses from across the globe who have taken time out to join us today. On behalf of GAPIO, it really is an honor for us to be able to welcome all of you to this event. And we are so overwhelmed to see the kind of response that we've had from across the globe. The father of the Indian nation, Gandhiji, had said, "A man can never be a woman's equal in the spirit of selfless service with which nature has endowed her." And we see an example of this in nursing, and that's why men cannot match the high standards women have set in nursing. I quote President Biden, and he said on the first day of the National Nurses Week, "I've often said, if there are angels in heaven, they are nurses. Nurses have given so much and saved so many lives throughout the course of this pandemic. Know that I'm deeply thankful and will always fight for you." Unquote. A thoroughly professional nurse with a smiling disposition and a caring attitude transforms care. And as a physician, I have seen this for 30 years. A nurse forms the thread that brings all the beads, the doctors, the physiotherapists, the dietitians, all the caregivers together. And for that, we are grateful to the nursing community. I don't know how many of us are aware that 5 incredible inventions that we use in day-to-day practice were created by nurses. Neo-slip, the compression stockings that we use every day. Cellu cotton, which has 5 times more absorption capability than cotton, was invented by nurses, and that set the stage for the development of sanitary towels. Feeding tubes for war veterans in the First World War, which is a sheet anchor for nutrition therapy. Ostomy bags and the crash cart. Truly amazing contribution, not just in care, but in innovation. The Global Association of Physicians of Indian Origin, or GAPIO, is a platform that aims to bring together 1.3 million, and I'll say that again, 1.3 million physicians of Indian origin on one platform. We have members from 53 countries. We have 15 programs that are very active, very vibrant, that we are running across the globe. And for us, enhancing our education, learning from each other is extremely important. In April 2020, on 11th, we launched the Global Indian Physicians COVID-19 Collaborative with the efforts of the American Association of Physicians of Indian Origin, the British Association, the Canadian Indian Network Society, the Canadian Association of Physicians of Indian Heritage, the Australian Indian Medical Graduates Association, and like-minded organizations, so that we could all work together, learn from each other, and fight the pandemic. Today, we are delighted to be partnering with such accomplished nurses, leaders across the globe. And for us, it is indeed a privilege. It's a privilege for us to learn about nursing innovation, how we're going to change the future of healthcare. It is now a privilege for me to introduce my colleague, Dr. Nandkumar Jairam. Nandkumar is a distinguished surgeon, an academician, an administrator. He has held leading roles in management, Columbia Asia. He was the CEO of the network, the National Accreditation Board for Healthcare Providers, And we are privileged to have Dr. Nandkumar as the Vice President of Gapio. Over to you, Dr. Nandkumar, for your remarks. Thank you so much. Dr. Nandkumar, are you able to join us?
Anupam, can you hear me?
Yes, go ahead, please. Yes, I know you're on the road.
I'm sorry.
Yeah.
Yes, my sincere apologies. But at the outset, let me say that whatever words you have just uttered are absolutely the truth and the whole truth. The nurses are the backbone of healthcare today. What I firmly believe is that the nursing profession has a long way to go and grow in healthcare, especially in India. We need to push the nursing profession to a different level and elevate them to the extent that is possible and enable them to do not just nursing, but to deliver healthcare in not just the urban but rural areas. I see the nursing profession changing its shape and growing in its strength and becoming a force that will walk side by side with the physicians and perhaps even ahead to ensure the highest levels of healthcare delivery. I have seen this profession transform in the 50 years that I have been in healthcare, from being passive to being active. And I see them moving forward to become dynamic healthcare leaders. I am so happy that Gapio, under the leadership of Anupam and able help of Anil Tandon, have organized this workshop. And I know one of many that will end it. Back to you, Anupam.
Thank you. Thank you so much. And really want to thank my colleague Usha for her leadership and for all the effort that she's put in along with Dr. Tandon to bring us all together. A big thank you. Thank you, Dr. Nandkumar, for your remarks. And I'm now going to invite my dear friend, Dr. Arun Gurg, who I routinely wake up at 5 a.m. because he lives in beautiful Vancouver. Arun is the president of the Canadian Indian Network Society. He's been in Canada now for 5 decades, but he's still Indian at heart and has been instrumental in developing several collaborations for us to be able to understand the genesis of diseases. And in fact, it's really fascinating his understanding of Eastern medicine and Western medicine and how holistic medicine is perhaps the way forward. He runs an amazing network in addition to all his clinical work. And he hosted us a couple of years ago in Vancouver. And we are hoping that we will bring the Gapio conference again to Vancouver should the SARS-CoV-2 virus and its latest variant, and I don't know variant number what, will be around in March or April, given the fact that the Greek alphabet has 24 letters. So we have a long way to go with the variants. But with those remarks, I'm going to invite Arun Bhai for his comments.
Thank you. Thank you, Anupam Bhai. Thank you, Dr. Tandon. I am coming to you from the unceded traditional territories of First Nation of Canada, Thistle Nautam. It's a small village, and it's a personal great privilege and a pleasure that I've been asked by Dr. Tandon and Dr. Sabal to introduce the next speaker. But before doing so, I want to reaffirm the words so well spoken by Dr. Civil. Canada-India Network Society is dedicated to build strong links and build healthy civil society. And it's a privilege to also share with you that subject to COVID happening, our next meeting is in June, and hopefully that again will be a midterm meeting with Gapio, and very appropriately the theme of that meeting is women's health and nursing and nursing profession, what they could do to that is just unbelievable. So it's so beautiful. And the leadership of Dr. Reddy to have the vision of creating GAPIO for global stewardship is just added benefit to building these collaborations. With those little few words, this time it's my distinct pleasure to introduce chair of our session, Dr. Agnes Tharady, who will then introduce the speaker, keynote speaker. Dr. Agnes Tharady is a senior vice president and system chief nursing officer at Friscan Health, Indiana, United States of America. She has done Masters of Business Administration from Northern Illinois University and a Doctor of Philosophy in Organization Development from Benedictine University in Illinois. Prior to working at Friscan Health, Dr. Agnes has held executive positions at Cook County Health and Hospital System and two veteran administrative medical centers healthcare system during past 10 years. Dr. Agnes is a fellow of the American College of Healthcare Executives and an American Nurses Credentialing Center's Board Certified Advanced Nurse Executive. Dr. Agnes has presented publications at international, national, and regional conferences on various subjects. Dr. Agnes is currently serving on the Nursing Advisory Committee of the Department of Nursing and Health at the Benedictine University and the Alumni Network of Commission on Graduates of Foreign Nursing School. Dr. Agnes' personal credo is creating lasting values for patients. Creating lasting values for patients by adding value to caregivers and caregiving processes. With those remarks, I invite Dr. Tharady to introduce our keynote speaker. Dr. Tharady, over to you.
Thank you, Dr. Gurg, for that kind words. Namaskar, good morning, good afternoon, and good evening. Dear fellow nurses, respected Dr. Anupam Sibal, Dr. Tandon, Dr. Jairaj Nandakumar, Dr. Gurg, Captain Dr. Usha Banerjee, Major General Elizabeth John, Mrs. Sridevi Balachandran, Dr. Rita Lakhani, Manju Palam, Dr. Manju Palam, and Lalita Garg, and all other members of the organizing committee who worked in the background to make this event today possible. And my dear friends, welcome to the first session of the Gap Year Nursing International Lecture Series. As you all have already figured out, the theme for today's session is Transforming Healthcare. It is a nursing imperative. And the topic for today's presentation is Nurse Innovation, Changing the Future of Healthcare. Creativity is thinking up new things. Innovation is doing new things. Theodore Levitt said this once, but our keynote speaker is the living embodiment of it. I am honored to help you get to know her a little better than what her bio delivers. She is a renowned nurse, the daughter of a nurse, an enlightening thought leader, an outstanding innovator, and an incredible entrepreneur, a down-to-earth nurse leader who genuinely loves nurses and nursing, someone who is making a real difference for better patient care by creating and leading the movement to transform healthcare through nursing innovation. She is the first director of nurse innovation and entrepreneurship in the United States through the Northeastern School of Nursing, the first initiative in the country designed to empower nurses as innovators and entrepreneurs. What better thing to do, especially today? She is the president of the Society of Nurse Scientists, Innovators, Entrepreneurs, and Leaders, otherwise known as SANSIL, a nonprofit society that quickly attained recognition by the United Nations as an affiliate member to the UN. She is the Chief Clinical Officer of IntelliCare Incorporated, the largest staffing platform for our nursing professionals in the US. In her own words, she did not get into this company for anything else but to invest in nurses and the nursing profession. Dear friends, as you will quickly hear from her, you will realize that she will make you smile. She may even make you laugh. She will make you cry. She'll make you wonder, and she will teach you the impact of why. She will help you rediscover your power to create, the power to make your dreams come true, to take your imagination to innovation, and help you, dear nurses, to recommit to nursing with purpose, passion, and pride. So, dear friends, please join me with the biggest round of applause to welcome our captivating keynote speaker for today, a contemporary global icon in nursing and healthcare innovation, one of my heroes, Mrs. Rebecca Love. Welcome, Rebecca.
Oh, thank you, Dr. Thodey. Thank you. That was such, just such a humbling opening. It's such an honor to be here with all of you and all of you distinguished guests from around the world. Good morning, good afternoon, good evening. And with that, we will dive in because we have quite a lecture and a speech in front of us. So let me see if I can share this screen. Let's start here. Dun, dun. Healthcare is broken. And I start here because the truth is, it's a reality that we have to speak truth to. Because when we recognize that something is broken, it means that there's opportunity to fix it. And for me, healthcare is broken and it's going to be nurses who lead us forward to fix the system. So I want to talk to you a little bit about healthcare today, and specifically around how we see healthcare in the United States. Healthcare is the fastest growing sector of the United States economy, employing in the United States over 18 million workers. Women represent nearly 80% of the healthcare workforce in the United States. But similar to the rest of the world, we faced the worst pandemic in 100 years in COVID-19. And with it, we saw that healthcare, the way that we did it, the status quo, the systems that we had used, the protocols that had been in place, largely failed us in the face of this pandemic. We faced significant financial pressure. At one point, the financial situation in the United States expressed that hospital systems were in dire straits of financial prediction for the next 18 to 24 months. We experienced significant shortages of PPE, supply chain challenges, highly complex and fractionalized workforce that made it very difficult for us to move our workforce around the country. And then seeing translations into significant challenges with the workforce going forward. In the United States, not different than India, healthcare is designed in a very systematic situation of a top-down structure in which administration sits on top of basically the largest workforce. And in the United States, that workforce is nurses, which is the largest population. Throughout the globe, though, let's look at nursing. There are 19.3 million nurses worldwide, according to the World Health Organization. That is not only the largest profession in healthcare, that makes nursing the largest profession in the globe. There are more nurses in the world today than there are teachers or doctors or police officers or any other profession in the world. And that is an incredible power to have behind a profession. In the United States, we actually have over 4 million nurses alone in the United States, with the average age of the nurse in the United States being 50, with 70% of the nursing workforce being over the age of 40. And why that is significant to recognize is that in the United States, nursing was a profession that came to life throughout hundreds of years, as we'll talk about. But in the last 10, 20, 30 years, we've seen a dramatic decrease in the amount of nurses that have been entering the profession in the United States. And with it, we see an incredibly aging workforce and not a replacement for this workforce like we see in so many others within healthcare. And this is a problem Because even as Dr. Nandikar spoke, nurses are the base of the healthcare workforce. They are the base of the pyramid of healthcare in the United States. When one goes into a hospital or a nursing home in the United States, it's because they need access to a nurse 24 hours a day, 7 days a week to maintain their life. When people are put to hospitals or nursing homes, it is not because they need access to a doctor or a physical therapist or an occupational therapist. All of that could be done in outpatient settings. Surgeries could be done, physical therapy could be done. All of those could be done external to the hospital. Why we have hospitals today is because we recognize that patients need 24 hours, 7 day a week healthcare coverage by a nurse to keep them alive. It is nurses and nursing care that demands the needs for people to be in hospitals and nursing homes today. And that is something that I think we forget in our healthcare system, that without nurses by the bedside, patients would die. And we must do something different to address this. Interestingly, in the United States, we graduate 175,000 nursing students a year. But in absolutely devastating numbers, we see that 30 to 50% of our new nursing graduates in the United States leave the profession of nursing in less than 2 years. And in fact, a recent study that just came out said that the largest exodus from the nursing profession today in the United States is from nurses who have less than 1 year of nursing experience. This has never happened in the history of nursing, that the youngest population, the newest population into nursing is leaving it at massive numbers. And what that means in the United States is we are facing a significant nursing shortage, and that we saw the largest retirement and exodus of nursing in the United States between 2020 and 2021, with a predicted another 500,000 nurses to leave the United States nursing profession by the end of 2022. And what that means in the United States is that although we were predicting a 1.1 million nursing shortage to hit the United States in 2030, we are expecting that shortage to now come and hit us somewhere between the years 2022 and 2025. And that is a global crisis. Because the truth is, if we cannot have nurses in the United States, if we cannot have nurses around the globe, it means the health of our nations will falter. Nurses are the barometer of health for our nations. When nurses are strong, our healthcare systems are strong, and our patients are stronger and better because nurses are there to deliver care. And these statistics, if they hold true, potentially lead to the incredible failure of our healthcare system going forward. I'm going to read to you a note from a nurse who was sent to me. I wish to tell you that I received thousands of really positive notes from nurses across the United States, but I don't. And this note came from a nurse who has 8.5 years of ICU experience, and he sent this letter to his hospital administration begging for help, and I share it with you. I believe, however, that the bedside perspective may be lost to many, if not most, administrators. The last 18 months have been the hardest 18 months of any of our careers, some of which span almost 40 years. They've been the hardest physically with the number and size and acuity of patients, with the proning and paralyzing, which means we carry the entire dead weight of every limb we move. We turn them every 2 hours, often alone because we don't have enough staff. I find myself without the time to raise and lower the bed and feel it in my neck and back. Almost every patient is obese, which only serves to exacerbate the physical toll. Safe lifting guidelines is 35 pounds a person, and the patient often weighs 7 to 10 times that. They each require interventions almost hourly, and there aren't enough staff to do it. So we deny our own needs to care for them by foregoing lunch, bathroom breaks, coffee, not even able to chart in a timely fashion. I left Saturday at almost 9 p.m., spending 1.5 hours after my shift to chart the entirety of the day's events. Our minds are racing with what else we're forgetting, what other new orders or labs or meds or titration or turn or pharmacy med request or RT page or central line dressing change or tubing change or glucose check we missed and need to collect, but we do it for the patient and family anyway. I have felt my capacity for compassion eroding over the last few months, mostly due to futility. This nurse received no response from their email, and they submitted their notice to their hospital system 2 weeks ago. Not only did he leave the bedside and his hospital system, but he has now left the profession altogether, taking a job on the corporate side of healthcare. Because every nurse who reaches out to me, all I hear from them is this brokenness, this feeling of futility because they are not heard. And when the depths of this pandemic hit them in the United States, it was nurses who stood on the front lines while most of our other colleagues ran for the doors. In the first opening weeks of this pandemic, it was the nurse who stood in those COVID units, often with the patients dropped at the doors and people flashing them signs on what they were supposed to do. And it was the nurse risking their lives and their livelihoods to care for patients that everybody else ran from. And with it, and as we come out of this crisis, we are failing to recognize the sacrifices, but more importantly, the impact that the nurses have had to healthcare. And if we don't do something differently today, we are going to fail the next generation and for it, healthcare in general. Now, in the United States, there's something very important to understand, and we are a system that is governed by financial dollars. Healthcare in the United States is a business. It is not something that we're proud to admit, but the reality is that it is a system which requires financial situations. On it, physicians, OTs, PTs, they add to the bottom line. They can bill for their services. In nursing, nursing is rolled into the room rate. And I want to tell you why that's important to understand. Because nurses being rolled into the room rate means that nurses are put onto the cost structure of healthcare systems. That means being a cost structure when you are in business. Business don't like to invest in cost. They want to mitigate costs. They want to decrease costs. So nursing is constantly de-invested in. And this all started back in the 1920s in the United States, when at the time, nurses had independent businesses. And when people wanted to access nurses, they paid them independently and privately. At this time in the 1920s, hospitals were a deplorable place where only the most destitute would seek care. Hospitals started to recognize that when nurses were brought into the hospital systems and few people were entered and given a bill, it was often the bill that the family would pay to the nurses because the nurses were seen as so valuable to getting that patient well. So hospitals started to recognize we should bring nurses into our hospital system and employ them. And so that is what they did. But at that time, when they looked to the world, they looked at hotels and they said, oh, maid service is rolled into the room rate. So we're going to do the exact same thing to nursing, which is we're just going to roll nurses into the room rate. And because of that, ever since Medicare and Medicaid, which is a financial model in the United States reimbursement to our healthcare systems, have fundamentally put nursing into the room rate, which decreases their value, places it on the cost structure. And because of that, nursing is constantly de-invested in the United States healthcare system. And until we change that model, where nurses are as valuable as everyone else to their institutions, we have a problem. And I want to just create this to make sure you understand. Most other healthcare professionals, other than nurses who deliver care in hospitals, are able to bill for their services, which generates revenue or cash flow to the hospital. Nurses not having a billable service are therefore seen as a cost to the hospitals, and they try to drive down costs in many businesses. Nurses are constantly asked then, therefore, to do more with less in hospital strap system, as adding more nurses would simply drive up costs. One could say that bedpans and gauze and bandages and medications are all more valuable to hospital systems, at least in the United States, more so than nurses, because they can be billed and reimbursed. Every time in the United States that you need more nurses to deliver care, the more costs are incurred to the hospital without direct association to drive any added revenue. And this is a fundamental failure. Because of what happens in this situation, if we don't start quantifying the value of the skills that nurses bring to the bedside from a monetary perspective, and I hate to say that this is as serious as it is, but money makes the world drive forward, and it is no different in healthcare. We must re-examine how nurses are valued from the financial aspect to our institutions so that we can strengthen our position in healthcare. And I want to go backwards in time, and some of you I know have heard me talk about this, but I always think after hearing what I just talked about, what would Florence Nightingale have done if she was to learn 75 years after the establishment of nursing that nurses were seen simply as a cost structure to institutions? My guess is that she would not have stood for it. But for those of you who have not yet heard this story, and for those of you who sit there and look at this screen and think, oh my gosh, please don't talk to me about Florence Nightingale again, because if you were like me, when I was a nursing student, I thought to myself, could there not be a nurse in the last 200 years of nursing history that could be slightly more relevant than Florence Nightingale to me as a nurse? But as in life, when you have something so fundamentally wrong, karma has a way of slapping you upside the face when you have it wrong. And for me, that was when I was at a book fair with my daughter, and she came across a book of Florence Nightingale, and she said, Mom, look, there's a book on a nurse. Can we read it? And I thought to myself, well, this will certainly help us go to sleep at night. So we bought the book, we came home, and at that night, I laid down in bed with her. And as I started to read the story to her, she fell asleep and I kept reading because this was the story I had never heard about nursing. And it is one I want to share with you now. It was the year 1854 and the British government was entrenched in a bloody battle called the Crimean War. At this time, women went largely uneducated, but Florence Nightingale had come from a wealthy family and she had been sent to school. And upon graduation, she chose to go to the front lines of this battle. Upon arriving, she penned a letter to the British government in which she wrote, "If you have wanted to create a place worse than hell, you have thus succeeded." For what she saw around her was that the soldiers were not dying from the death and the disease that they seemed to hit them, or the injuries that they sustained on the battlefield, but seemed to die from the death and the disease that seemed to follow the physician from the bedside to the bedside to the bedside, as he did not wash his hands nor sterilize his medical equipment. Now, Florence Nightingale had to be meticulous in her ideas and in her notes and in her documentation and her research, because at that time, germs were thought to simply be a figment of one's imagination. If you could not see it, it did not exist. And at that time, the medical status quo was that germs did not exist. So Florence Nightingale had to challenge conventional medical practice. She had to challenge the status quo to show that washing one's hands and sterilizing medical equipment not only stopped the spread of disease, but it saved patients' lives. Florence Nightingale challenged conventional medical practice to found nursing. Nursing was founded on challenging the medical status quo and driving healthcare to be better. Our profession, nursing, did not come in to simply exist alongside medicine, but it came in to pull medicine out of the dark ages of practice and drive healthcare forward to recognize the value that nurses bring to seeing the patient first and seeing the world through a different lens to transform healthcare. And that is the power of nursing. Nursing was founded on challenging the status quo, doing things different, representing a new population, and driving incredible outcomes to change the future of the world. And one of the things that you may not be aware of, in the 1920s in the United States, women were not allowed to vote in the United States. And it was nurses who organized to help move women forward for the first right to vote in the United States nearly 100 years ago. Not only did they innovate, not only do they stand by the patients, but nurses historically throughout history have been one of the most powerful representations of global change for the greater good of any profession in the history of the world. So I always ask people, and people always ask me, Rebecca, why nursing and why innovation? And I think hopefully you now understand why nursing, but let's talk a little bit about innovation. I'm not sure if you know who this person is on the screen, but if you don't know, that's a man by the name of Henry Ford. And Henry Ford had a great quote when people asked him what was innovation, which he said, if I had asked people what they wanted, they would have said faster horses. And what that quote means to me is that innovators see what yet does not exist. They believe in the impossible and until it is possible. They see what yet has not yet been seen. And it is this that makes innovation so powerful. It is the moment between stagnation and progress, and it is absolutely what is necessary today. And people ask me all the time, well, what makes a great innovator? And I said, I think the simple one is if you have a belief that you can make something better, you are an innovator. And there are no truer innovators than there are nurses. In the United States, on a hospital floor, nurses on average are doing 27 workarounds per shift in 36 different places in the course of an hour. So that means they're innovating in highly inefficient healthcare systems. I don't know about you, but so many of us are at situations that workarounds in nursing are seen as a bad thing. But at other places like Google or Amazon, if you work something around to make it better for the end user, it is a situation that you are awarded for, but in nursing, you are penalized for. Mm-hmm. And this situation, the truth is we must stop the insanity. That means doing the same thing over and over again and expecting different results. Because the truth in our profession, we have so much power. So people ask me, Rebecca, how can we make a situation, because we have to follow protocol, we have to follow policy, because we can't just go rogue and allow nurses to keep innovating at the bedside, because the truth is we know they work in most of the situations. So how can we do this safely? And for me, the answer came when I went to a hackathon. So I'm going to tell you a little bit about my story and how a hackathon changed my life. And then we're going to dive into how you can manage this going forward. Back in 2015, I was a struggling nurse entrepreneur. At that time, my business was going out of business. And a friend of mine said, Rebecca, you need to go to this hackathon. And I said, Nick, what is this hackathon? He said, it's a 3-day event where people from all over the world come together, pour out problems that they want to solve, form teams, and over the course of the weekend, they solve those problems. It was brilliant. I remember a blizzard was blowing in that Friday night. I drove into the city and I joined in this room where everyone from the hospital system was there. The CEO was there. All of the physicians were there. The engineers, leaders of most of the healthcare companies in Greater Boston were attending. And as I walked around the room, I thought, oh my gosh, this is where the decision makers are. I'm not supposed to be here as a nurse. And I thought to myself, nobody's asked me to leave, so I joined a team. And over the course of that weekend, I learned more about the business of healthcare than I had learned in an entire 2 years of trying to start a business. But what happened to me in those moments is we were sitting in a room and in would walk the CEO of the hospital system and he would sit down right next to me. And he would say, what's the problem? And we'd start talking about the problem. The doctor would start talking about the solution. The engineer would start talking about the solution. And I would say, well, you know what? That's really great, but that's not how it works on the hospital floor. And they say, what? how does it not work like that, Rebecca? Tell me, what do you mean? And I started to explain, well, as nurses, this is what we do. And all of a sudden, everybody at that hackathon was seeking me out to say, Rebecca, how do nurses do this? How would this work better if we brought it to the hospital system? What do we have to know about nursing to make sure that this solution takes root? And I had never been engaged in such a positive way. But what I recognized is that nurses had the practical knowledge to create great healthcare solutions. And that maybe all of this time of everything that we've been doing in healthcare, why all these things keep failing, was because simply nurses never were involved in the conversations to create the solutions that we need. So I said it was time that there had to be a nurse hackathon. I started to call healthcare system, hospitals, and universities across the United States after learning from colleagues of mine that ran hackathons, that very small percentage of nurses attended hackathons, but a vast majority of the teams that had gone to these medical hackathons had nurses on them who won. So I knew that nurses had something of value there and that there had to be a nurse hackathon. Well, I made hundreds of phone calls, often the phone being hung up on me even before the conversation began, until I connected with Dr. Nancy Hanrahan, who at the time was the Dean of the School of Nursing at Northeastern. And I explained to her my situation. And I said, Nancy, you should host a hackathon. And she said, well, Rebecca, next year, I'm going to run a summit on innovation and entrepreneurship. Let's see. Okay, I saw that. Thank you. I think we're ready to keep going. And Dr. Hanrahan said, Rebecca, we're going to run a summit on innovation and entrepreneurship. Why don't you run a hackathon? And I said, well, I've been to a hackathon. Sure, I'll run a hackathon. And that's what we started to do. For the next year, we built to this conference. And in 2015, if you look at the research, you guys, there might be a handful of articles that mention nurse, innovation, and entrepreneurship in the same article, but not one of them mentioned them in the same sentence. At that time, nurse and innovation and entrepreneurship was simply thought to be a fad, something that had nothing to do with nursing. We had no idea anyone was going to attend this event. Because the truth is we weren't sure that anybody would believe that nurses should be innovators. But suddenly, 2 weeks before the event, Dr. Hanrahan calls me and she says, Rebecca, I want you to come on and be the director of nurse innovation and entrepreneurship at Northeastern School of Nursing. Our event is sold out. There are people from all over the world attending. Major corporations like Johnson & Johnson and Deloitte and Microsoft are flying people in to hear what this event is. And I said, well, Nancy, what program are we going to model after? What is going to come next? And she said, well, you know, Rebecca, what I no longer want to happen is I don't want nurses to just graduate with a stethoscope. But I want them to graduate with a briefcase, to have the business knowledge that takes them from not being only a seat in the audience, but allowing them to have a seat in the boardroom. We must bridge that gap of nursing school that we've always taught the world of empathy, which is, I believe, but teach them the business skill sets of the financial models, the strategies, and the operations to drive significant change. And I said, Nancy, that's fantastic. What program will we model after? And she said, well, there is none. We are going to build the plane as we fly it. And that was June 2016. And in the course of the next 2 years, we hosted over 30 different events that ranged from local events to national stages to drive nurse innovation forward. But one of the most exciting things happened in 2017 when Johnson & Johnson called us and asked us to come to New Jersey, in which they said their campaign of thanking nurses for the last 15 years they felt was failing and no longer driving nurses into the profession or keeping them by the bedside. So they said, in 2017, based on the work that we were doing, they were going to pivot their 15-year campaign of thanking nurses to focusing on nurses as innovators, as the future of their campaigns, because they believed this was the best way to save the future of the nursing profession. As things happen, life changes. So too did our time at Northeastern End. And then one day I went for a walk and I started to realize it was actually right around New Year's. And I remember thinking to myself, I had missed all of the nurses that I had worked with. And so I had this vision of Saint-Ciel being formed, a new nursing society in the world that would focus on a world where nurses were significant leaders recognizing for transforming healthcare in our society, and with a mission to magnify, network, and elevate the expertise of nurse innovators as transformation agents that contribute to the reform of healthcare, and to leverage and disseminate the trust that these nurses have earned. And in the past 2 years in the foundation of that organization, we have run global hackathons. We have written a book. We participated in the United Nations. We moved over 300,000 pieces of PPE when the COVID pandemic hit, organized by nurses that all volunteered. And every single day, this society focuses on how can we push the nursing profession forward. Most recently, we just hosted, and I wish you could have attended, nursehackforhealth.org. Please put it on your calendar. Our most recent hackathon, in which we've partnered with J&J, Saint-Ciel, and Microsoft for the past 2 years, running biannual hackathons to engage nurses on the front lines of innovation. And I hope you'll attend our next one in which we do them. And I want to share with you, because I want to give you some takeaways of what is a hackathon. And I know we can't do this with the whole group, but I wanted to show you, how do you come about innovation? What action can you take back to your organization to say, I hear Rebecca talking about hackathons, but I have no idea where to begin or what to do. So I want to show you an example of how I would run it. There are things called hackathons. There are things called reverse pitches. Either way, it's all about driving innovation and allowing the people on your front lines to come up with the solutions differently. Because it is those who are on the front lines that truly know where the barriers exist to drive and be able to drive new solutions to address them. So there are 3 parts of driving new ways of thinking. So if you are looking to do an activity with your group, this is how you would frame it. Identify a problem that you want to solve. Perhaps it is falls, or perhaps it is retention because nurses aren't staying, or perhaps it's recruiting more nurses into the profession. What is the problem and how do you currently experience it? Next, you ask the team, how do you currently handle the problem? And lastly, the third question, which is where the magic happens. How could you solve it differently? So for example, let's take falls. What is the problem that you currently experience? We have large amounts of falls in our hospital systems. How do you currently handle it? We put patients in restraints so that they can't get up and fall. How could you solve it differently? We could remove the restraints and try new situations where groups are sitting in communities and allow people to monitor them by more activity and matching people up differently. The idea is, look at the problems that you face and think about how you could do them differently. Because the truth is, the future of healthcare is in our hands. And the future of nursing is in our hands. And the problems that are facing our profession today are significant. And we can't keep coming at them the same way that we have been. Because if we do, there won't be nurses in the future. And that would be a crisis in and of itself. And we can do better. Steve Jobs says, innovation is what distinguishes between a leader and a follower. And it is time now that we need strong nursing leaders more so than ever. So innovate, challenge the status quo, and demand different outcomes to problems that you know exist and that no one is addressing. It is your time to change it. So again, how do you make it happen? Start an innovation committee at your hospital. Do virtual nurse meetups just like what you're doing here. And host a hackathon. You will be blown away by the solutions that you come up with. Reverse pitch events allows you to throw, it's like a hackathon, where at hackathons, people bring their problems to the front line and say, hey, look, I want to address for me, I have patients that have this situation, I want to address that problem. Where reverse pitch events are you put the problem out you want them to solve. So that's falls or cardiac arrest, anything, you allow them to come up with new situations. And the most important thing to remember is you must bring people of different backgrounds together to create new solutions for problems. When you bring people of the same background, the same experience to solve the same problems, you're always going to get the same answers. The magic happens when you bring people all the way from the porter at the very front lines to the house cleaner, to the nurse, to the doctor, to the patient, all in the same room to solve these problems. That's how you come up with brilliant solutions. And always, always engage that end user. To every nurse who is on this phone call who thinks, nobody hears me, I want you to know that I was a struggling community college professor with a failed startup when I went to that hackathon. I can't believe that I am here with you today, because the truth is, I never imagined that it would happen. But people ask me, Rebecca, why has life, what happened to help you get to where you are today? And I think the only answer that I can share with you is mindset. And this piece of advice. The only thing I can control is my response, my attitude, my perspective. I get to control what I make this mean. Don't let others define your passion. Keep going, keep believing. I got more no's and hung up the phone on in my entire life than I ever did. And all I needed was that one yes. Keep going, because when you find others who believe like that, I found my group of Sanciel nurses, and we would love you to be a part of it. I know that we have each other's back because we believe fundamentally a rising tide raises all boats, and there's enough success for everybody in the world, and champion them on. And here is an example of nurses who are doing things differently, not only in the United States, but around the world. Hiyam Nadel is the first director of Center of Innovations, a nurse for the first time ever at Massachusetts General Hospital leading that. Marion Leary is the first director of innovation at University of Pennsylvania. There are so many rock star nurses doing things differently. We want you to be part of it. So I want to leave you with a quote in a video, which says, and Florence Nightingale said this, were there none who were discontented with what they have, the world would never reach anything better. And what that means to me is in the moments of greatest darkness and in moments of greatest challenge, you have the opportunity for the greatest change. So don't let today's situation, which feels so overwhelming, beat you down. Hold on to it, embrace it, and recognize now more than ever, you have the opportunity to change the future. This is my contact information. Please reach out to me. I'm going to try to share a video with you guys right now. Can you guys, let me just make sure that share sound. What I want to share this video with you guys real quick. And the reason I want to share this video is when Johnson & Johnson did the research to do this video, they had to hire an expert in the deep web to find these stories. Because what they realized is that so much of nursing history has been erased from our memory. So I want to tell you, don't allow that to go forward. Capture every incredible nurse innovation and nurse innovator around you and write it down and champion them on. Because we cannot let our nursing history be erased anymore. Because it is because of nursing that so much has been accomplished. So let me see. All hear this?
During the Crimean War, more soldiers died from infection than in battle. Until a nurse introduced sanitary practices still in use today. When the scourge of polio hit the world, it was standard practice to strap down and immobilize patients. Until a nurse discovered that movement and physical therapy had far better results. In the 1950s, jaundice was a leading cause of infant death, until a nurse found that a few hours of sunlight could actually cure the condition. At the dawn of the AIDS epidemic, no one knew how the disease spread, so patients were kept quarantined and alone, until nurses defied convention and embraced them with compassion. During the Ebola outbreak, the disease was thought by many to be too contagious to treat, until a student nurse used what she had on hand, garbage bags and duct tape, to protect herself so she could care for others. And cerebral palsy robbed many patients of their ability to speak, until a nurse gave them back their voices. And I will always be grateful to her.
Share. That should be it. Oh, sorry. How do you think I went? So sorry, I don't know why that did that.
Rebecca. Let us all give Rebecca another big round of applause for her electrifying presentation. As you can see, passion for nursing and passion for innovation oozes out of Rebecca. And I was a little uncomfortable. I wish I could run to her with some water as she was struggling to speak, but that's Rebecca. What you see is what you get. Rebecca, a big round of applause to you from the bottom of our hearts.
Oh, thank you so much, Agnes. I do appreciate it. I do know. I'm so sorry. I have had a cold for the past 2 days, so I know. I apologize. But thank you. And I will put the link into the video here. I apologize if you weren't able to see that.
Okay. Rebecca, some of our audience was so enthralled by your presentation, and they were wondering if you will be sharing the slides with them.
Happy to. I will store those right on so that you have them.
Okay, thanks so much. Okay, so Rebecca, I know we are maintaining a tight timeline. So we have a few questions for you. I just want to say the amazing journey that you took us through to be able to appreciate the backdrop of why nurses have to innovate. And then you told us how nurses can innovate with the help of your story and how you're encouraging us to be able to go through this process, even though we may not have started, was just mind-blowing. And I think there will be many in our audience who will realize that Rebecca is paving the path for us. Rebecca is helping us to be able to get to a place where we too can do it. And that's the beauty of this presentation. That's the takeaway that I have. I just wanted to ask you one quick question, Rebecca. There are 2 or 3 in our audience who may have questions, and I'm going to ask Usha Banerjee, who is our committee member running solo sometimes for this event, to be able to pick some question from the audience that she would like to share with you for your answer.
At the outset, I must congratulate you, Rebecca, for such an electrifying conversation here today at this wonderful international platform. I had goosebumps and I had almost tears in my eyes listening to your passion, and of course, chaired by Dr. Agnes Taradi. I think what you spoke about is moment between stagnation and progress and changing into a wonderful culture. So one of the questions that came up from the team here is that, just give me a moment. As we are into the digital transformation, how do we balance high tech and the touch? So I have just this one question from the audience because we are running out of time.
It's a balance for everybody. And I think what the biggest thing is that we must remember that we cannot take away the caregiving in place of technology. And that much the technology that we've rolled out has actually created more work for our front line than it actually created less. And so the reality is what we have to start demanding from technology, and what you should all start demanding, is I am not going to work with systems that deny me access to taking care of my patients. I am no longer going to be standing between a machine 50% or 70% of my shift when I should be demanding taking care of those patients, and pushing back on those businesses who are making billions of dollars off of healthcare to say, we're no longer using technology that does not drive outcomes and allow me to do my job more efficiently. And the truth is that we're starting to see that happen in the United States. I've started to speak with nurses who are interviewing other nurses, and they're saying, do you have this system? Do you have this technology? Do you have this tool? Because if you do not, I'm not going to come work for you, and if you have this system, I'm not going to work for your systems, because I'm not going to live my life and my work balance that way anymore. So it is behind us as a profession start defining the work situations that we will work in, and in this institutions are. We're seeing this happen in the United States all over the place. And for the first time, a major shift in power, that nurses, when they starting new jobs, are able to define what the systems and the technology and the tools that they need to do their job better exist, and also start demanding to sit there and say, when there are technologies that fail them, that they have a way to say, I'm not using them anymore, and let's figure out a better way forward. So I know that feels very uncomfortable, but I think that's where we need to go.
Amen to that, Rebecca. I think that is the power of being led by a powerful innovator and an entrepreneurial thinker. I just had one quick question for you. Oftentimes, the strategy experts will acclaim that creativity and innovation are essential for success of any industry, any organization, and more importantly, in healthcare, as you just outlined for us. However, many organizations fail to support it. Do you think the facts bear this out? And if so, as a leader who walks the talk, what is your advice for us who may get frustrated by just lip service?
This is, there is no silver bullet. But what I suggest you do is you find 2 or 3 of your colleagues who feel the same way, and you band together, because the truth is strength comes in numbers. And the reality is healthcare, as we all know, in the United States, if you go to any major healthcare conference, the conversation always is, we must blow up healthcare. The system is failing us. It's not working. Now, the challenge is in the United States and across the world, it is failed because we do business the same way over and over again. The reality is, COVID opened up the window for us to drive these changes differently. It gave a platform that nurses finally were elevated and recognized to lead those changes. So when you are finding that there is lip service, it's not happening, I'm going to tell you, you have to go external to your walls. Hence why I formed Sanciel, because I went and I found those nurses, the chief nursing officer of Microsoft, the chief nursing officer of Cleveland Clinic, who I had met, who had tried to do things differently. But when we got together and formed our own independent platform, it was when we could start moving the needle, because we could start having our own events, start driving our own conversations, start networking with those individuals external to our systems on behalf of the organization we were representing. That's why we could partner with J&J and Microsoft. I did not need my employer to do that. I created a place that welcomed others in, and I think that's exactly it. If you're not going to get a seat at the table at your institution, make your own table. That's where we are in nursing. It's no longer asking for a seat. And the truth is, here's also what I do, and I know it's very uncomfortable. I stopped going to conferences led by nursing and started to go to the conferences led by industry and being there. And I would be the only nurse in a 5,000-person conference. And let me tell you, everyone there wanted to know what I had to say, because nobody had talked to nurses. So my advice to you is stop just talking to each other. Start going where, I hate to say, where the money meets the road, which is where industry meets the direction, and spend your time there. Start going to conferences where you can meet people who can help drive this initiative forward differently.
Well said, Rebecca. How grateful we are for empowering us with what you just said. Any other questions? We may be able to take 2 or 3 more questions in the next 4 or 5 minutes.
Rebecca, this is Sridevi, and thank you so much for your wonderful talk. Could you share thoughts on how we could actually, what should we do in nursing education to accelerate innovative thinking? I'm an educator, right from what I ask, I'm sure you know this, and it will help a lot of us.
I love this. You can do so much. In fact, if you can make the new next generation believe that they're innovators before they get out there, you're going to immediately unlearn a lot of bad behaviors that we learned as nurses. So establish a course in innovation, have them all do a senior project about, see a product that does not work, how would you make it better? Give them the power to drive those things forward. Do hackathons within your organizations and collaborate with all of the schools, your school of engineering and your school of nursing, your school of medicine. Bring everybody together for a weekend to actually define a hackathon and see the power in which that happens. More importantly, what we have done in nursing education is we teach to a test. We understand that is important, right? But the reality is in nursing school, we must define our education beyond teaching to that test and bring in business fundamentals. You need to treat strategy, finance, operations. People need to understand business is a healthcare so that when nurses go to speak to their manager and they say, I think we should do this. And the CFO goes, that's great that you think that way. Or I feel if we did this, it would save patients' lives. And they're like, that's great. You feel that way. That's what happened to me all the time as a nurse. They would play lip service. But what I realized is I didn't have the language to make the argument, which is I believe that financially, if we took $1 million and invested in this program, here are the 5 metrics we'd outlined. This is going to drive the outcomes and financial reimbursements of $6 million over the course of the next 3 months. You need to give nurses the skill set. No longer can you just tell them, hey, that's great that you feel that we're very empathetic. You need to tell them how to speak to a business case. So nursing school, fundamentally right there, every argument, every presentation should have a financial model, it should have a competitive analysis model, and it should have an end goal of how that change is going to impact the bottom line. How many patients' lives it will save, how many dollars it will make, how it's going to be funded. And then you're going to change the future of our profession.
Awesome. Awesome. One more question, please.
Thanks so much.
Anyone for another question? I may take this opportunity. Do we have another question?
I think we're running short of time. Otherwise, I would love to ask a question.
All right. So here's what we're going to do.
Chat. I'll put it in the chat.
Okay. So here's what we're going to do. We wish we had more time with our terrific Rebecca, but we know that all good things come to an end. So here's what I want to say. Those of you who have posted questions in the chat box, we want you to know that your questions are important and need to be answered. So please do us a favor. Please write to transformationteam2@gmail.com and send us your email address so we could get you the answers to the question. And I am saying this in anticipation that the questions that we may not be able to answer, we will refer it to Rebecca, and when we get the answers, we will send it to you because she is devoted to make a difference for nursing. So I am claiming that she's going to do that for us. So as we come to the close of it, Rebecca, we have a tradition in India that we like to express thank you from the bottom of our hearts by saying Dhanyavad, which means thank you in Hindi. On behalf of the leadership of GAPIO and the organizing committee, I salute you and thank you for this memorable and enriching experience. May God continue to lift you, Rebecca, and your work for the greater good of mankind, because that's what we aspire for, to make a difference to the world. May you continue to inspire many more nurses and many more healthcare professionals to become the best version of themselves, because you are the best version of yourself to us. God bless you. God bless everybody. And over to Dr. Gurg.
Thank you. Thank you, Dr. Tardi, and thank you, Rebecca, if I may say so. Wonderful, wonderful presentation. And this is my privilege and pleasure now to thank everybody. But before I do that, I will be remiss if I don't share with you. Your passion and your enthusiasm fires us. After 50 years of practice as a physician, hand in hand, side by side with my colleagues in nursing and as a medical doctor in lab with my medical lab technologist, the empowerment, collaboration which you alluded is a must. But I will be missed, Rebecca, if I don't share with this great crowd the principles which you enunciated are embedded in integrative thinking, how we think about things. And that is so close to Vedic philosophy of artha, moksha, kama, and dharma. And that's what we need to translate to bring us alive, to make the difference. Artha, when you talked about business cases, you talked about finances. Dharma, doing the right thing. Nurses have and been doing the right thing, and you brought that out. The reason I bring that out is that people like us with heritage in India needs to bring the change from the heart, and that heart is imprinted in our heritage, and that connection has also been made. So it's not just modern science, there is an ancient wisdom. So everything you said is so solid, embedded, and you have found that recipe. So thank you for sharing. You have modernized it. It's wonderful. In the end, I would like to conclude by thanking all our speakers, Dr. Jaram, Nandakumar, Jairam, Dr. Sybil, organizers, obviously the keynote speaker, and it takes a lot of people to put something like this together. Audience, the IT, and most important, our audience. Please use this as an inspiration. Apply it, and it worked. And with all together, our future is bright. Use COVID as an opportunity to bring the transformation which is needed. Dr. Love is absolutely right. System is broken. We have to fix it, and we will do it together. So thank you very much. Namaste, and have a good day. God bless everyone. Bye-bye. Thank you.
Thank you, Dr. Agnes, and thank you, Ms. Rebecca and the entire organizing team. What a wonderful evening. What a culmination of a great event. Thank you. Good night. Goodbye.